Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. So what is vestibular rehabilitation physical therapy? To keep it simple, physical therapy is a branch of medicine that uses education and the body's own ability to heal and adapt in order to improve at just about anything dealing with healthy movement. Your muscles get stronger when they get fatigued. Your ligaments get tougher when you strain them. Your bones get denser when you bear weight on them. Coordination gets sharper when you challenge your fine skills. Exercise is the main ingredient for physical therapy to get your body improving. And exercise is just intentionally challenging the body so that it gets stronger and better than it was before the exercise. There is not a human body out there that would not improve and benefit from exercise. And the best time to start is right now, before there's something that needs to be rehabilitated. Meanwhile, the vestibular system is the part of your body that deals the most with our balance and orientation. It's responsible for telling us exactly where we are and how much we're moving. And it's found inside your ear, but it is totally separate from your sense of hearing. We don't have 5 senses, way more than that. Dizziness, imbalance, and vertigo are the main complaints when something is off with the vestibular system. So in the case where a person develops a problem in that part of the body, moving freely suddenly is a lot more difficult, which is when a physical therapist jumps into action. So, most of vestibular rehabilitation involves taking movements that cause you dizziness, breaking them down into movements that either shrink the movement or slow down the movement, and then building up so that you build a tolerance for the things that you struggle with until you don't struggle with them anymore. Over time, we're going to get moving bigger, faster, more specific, more complex. For imbalance, I'm going to be hanging on to you with a nice belt around your trunk for safety, but we're going to move in ways that make you off balance. That's the key. What do you struggle with? Let's do it again and again and again until you don't struggle. For vertigo or a spinning sensation, it really depends on the cause. The most common cause, BPPV, has a totally unique treatment that might seem strange, but is a diagnosis that has no lasting issues and can be treated pretty quickly. Check out my diagnosis video on BPPV for more. For other causes of vertigo, because there are many, it can be treated in a similar way to dizziness. Practice what you struggle with using exercise. Now, how many visits, how frequently, what exercises, it's all quite variable to you, your lifestyle, your needs, and more. My 20-year-old patient with vestibular migraine who tells me she doesn't feel like she'll be able to practice Muay Thai very well, and my 88-year-old patient with a labyrinthitis who doesn't trust his cane as much anymore, those treatments are going to look quite different, and they may recover at different rates. Though, I will say with good homework, both of those cases, you might see recovery faster than what you might expect. I don't personally give a ton of homework. My exercise routines are usually 2 to 3 exercises, roughly 5 to 10 minutes per day, and I always make a printout. You have pictures, instructions, you don't have to remember a thing. Now, these exercises are specific to you and your daily life. So tell your physical therapist, what do you struggle with? There are 3 things that I believe any exercise routine should have, especially when it comes to balance. Number 1, safety. I've never had a patient fall during homework because I always give instructions that also include how to keep things safe at home alone. Number 2, challenge. I'm personally not going to get much stronger if I use a nice little light dumbbell because my body doesn't really see a problem if I'm lifting it easily. But 50, 60 pounds? Oh yeah, that challenge, that's gonna really strain me close to my limit. So my body sees a reason, I'm not strong enough yet. It's the same for overcoming dizziness. If the balance challenge or the movements don't challenge me enough, why would my brain see a reason to change anything? And number 3, consistency. You could brush your teeth 2 times a day for 2 minutes, that's 28 minutes a week, or every Saturday get up and brush for 30 minutes straight. One of those is probably going to help your teeth a lot more than the other. So if you do a little bit of dizzy challenge every day, the brain can adapt pretty regularly. My job at that point is to just come up with exercises that get a little harder over time and a little more specific to your needs. Golfing, cleaning, sitting up in bed, etc. But if you're doing every single day, the brain doesn't want to be dizzy. It's going to have to change. An important thing that I tell patients often, there is nothing magic in the exercises that physical therapists give for most diagnoses, even beyond the vestibular realm. There's no such thing as a bad exercise, maybe just not one for right now. But there are many ways to improve, and a physical therapist is here to guide, to educate, to encourage, and to advance you into harder exercise. After all, my goal is to kick you out because you're all better. I don't want to see you come back. I want to see you moving. The best thing you can do is to get moving, but if there are barriers in the way, whether it's because the symptoms just seem too severe, safety concerns with balance, complexity with multiple issues at once, or just plain fear, well, that's what I'm here for. I want to give you every tool you need for you to overcome this with your own confidence, your own body, your own effort. If you don't do the homework one day, you won't necessarily lose all your progress, but the sooner you want to improve, the more you should push yourself and let your brain know that this is something important and it is something that needs to be corrected. For many diagnoses, this is the gold standard for treatment. And often, medication is actually something recommended against, as that can delay your improvement. I have a whole video on the concept of medication for dizziness if you're interested. If you haven't heard of vestibular rehabilitation before, that might be because many physical therapists do it without a special title. But it's one of many things that this profession is equipped for. There are specialists like myself out there, which that just means we're the biggest nerds for this area of the body and of health. If that's something you're interested in, visit your doctor, an ENT especially, and ask them, do you know of any vestibular specialists out there? To summarize, vestibular rehabilitation is a specialty within physical therapy as a whole. All of physical therapy uses education and exercise to challenge the body and mind to improve at moving freely, and vestibular rehabilitation is no exception to that. If dizziness, imbalance, and vertigo are a challenge for your life, find a physical therapist who treats vestibular diagnoses and work hard at your homework to push yourself back to where you were before, if not greater. If you're not sure where to start, visit your doctor, especially your ENT or your physical therapist, and tell them your symptoms and your interest in vestibular rehabilitation. This is a specialty that really deals with some of the most unpleasant symptoms out there. Vertigo can be devastating to a person's life, and dizziness and balance affect almost every movement and activity we have. But improving is very achievable. I am so very happy and blessed to be a vestibular rehabilitation specialist, and I pray that you are able to find the help you need to overcome this time in your life, because that's just it. This is one time in your life. It's not a lifetime sentence. Get the help you need to improve. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day, and may God bless you with stability throughout your dizzy therapy.